Hello everyone, my name is Sherifat Abdusalam. I have my badge on, I'm wearing my scrub. I'm here today to perform ophthalmic medication administration. First thing I'm doing here is I have my supplies with me. I have the eye drop, I have the cloth to clean the patient's face, I have gloves, and I have my modified receptacle for trash. And then the first step I'm going to take is I'll verify the doctor's order and make sure it's properly worded and it followed the 6 rights of medication administration. The order states that I shall administer timolol 0.25% solution 1 GTT in each IBID, which is twice a day, and the GTT is 1 eye. So it says 1 GTT, that's 1 drop for each eye twice a day. I'll verify that this order goes with the 6 rights of administration, which is the right patient, the right drug, the right dose, the right route, the right time, and then the right documentation. Throughout this process, I'll go only with the 5 rights. The 6 rights, which is documentation, will be the one that comes at the end. Once I've done that, I'll also check if there is any known allergy for the patient, and then I'll check this medication. I'll go to the EHR to confirm the medication. At that point, I'm going to take the medication and visually observe that it actually follows the right order, which is timolol 0.25 solution 1 GGT or drop in each eye twice a day to be administered. Once that is done, I'm going to gather all my supply and go into the patient's room. Knock, knock. Hello, my name is Sherifat. I'm going to be your nurse today, and then I'm going to provide privacy. If for any reason the patient's family were in the room at the time I go in, I'm going to ask the patient if they want the family to stay. If they don't want the family to stay, I'll have them excuse. I'm doing this because I don't want to violate HIPAA protection. Once that is done, I'm going to ask the patient to identify themselves two-way. Can I know your name and date of birth? Once they state that, I'm going to verify their identity using the wristband. I'm going to ask the patient if they have any known allergies, and once they say they don't have any known allergy, I'm going to explain the procedure to them. So Mr. Smith, I'm here today to administer timolol 0.25% eye drop as ordered by the doctor. This medication works by reducing eye pressure, and then it's also used to treat glaucoma and high pressure. There are some common side effects for this medication. There are some common side effects for this medication. You might experience some irritation, stinging, or burning when I administer it. This is one of the common side effects, so if you experience that, please let me know. And once you feel that, because when I administer it, you might actually feel some burning sensation and irritation, do let me know. Also, this medication, it's rare, but then it happens. You might experience some adverse effects using it, which could be hypertension, even heart failure. You might have coughing, dizziness, shortness of breath, and fatigue when you use it. If you experience that, please let us know. Do you have any question for me? If the patient says no, I'll proceed. If the patient says they want to self-instill the medication, that is also allowed. It just has to be done under supervision of a nurse. So at this point, I'll also let the patient know that if they are receiving mydriatic eye drops, that one can cause light sensitivity and blurry vision. Those are the ones that dilate the eyes. And then once this is established, I'm going to perform hand hygiene and wear a glove. Once I've worn the glove, I'm going to help the patient to a comfortable position. Preferably, I want the patient to be in supine position, but then if they are sitting, I want their neck to be hyperextended so that it will be easy to administer the drug. And then if they're on the bed, I'll either want to raise the bed or drop the rail as suitable, just to make sure the administration process is successful. Prior to administration, I'll also try to observe the eyes and wash away any dry crust on the eye. This I'm going to do using a warm washcloth. So this is my washcloth. It's already warm, and then I'm going to do that by, it's warm, I'm going to use this side first. So I'm going to do that by applying it on the eyelid gently, no pressure. I'm not pushing it down. I'm going to apply it because it's already soaked, and this is also to soak the dry crust so it's easy to clean. And I'm going to clean from the inner canthus to the outer canthus, and this I'm going to do one time. I'm going to switch the side of the washcloth and do the same on the other side. Little pressure on the eye for a minute or so, let it soak, and then I'm going to wash from inner canthus to the outer canthus. I will not scrub the eyes because that's going to contraindicate what it's for. And then once this is done, I'm going to put in my makeup trash bag, and then I'm going to remove my gloves. Perform another hand hygiene and wear another gloves, because I don't want to, that one is already contaminated. I don't want to transfer, I don't want to contaminate the eyes again. Once I've done the hand hygiene and I've worn this, I'm going to take the medication, remove the cap in preparedness for administration. To start the process, I'm going to take another washcloth and I'm going to apply it on the eye. So this one I'm going to apply on the cheekbone below the eyelid. I'm using this section so that it's easy to see. I'm going to put it on the cheekbone under the eyelid and put a little pressure on it, and that pressure is actually supposed to help open the conjunctival sac so that it will be easy to administer the medication. I'm using my forefinger against the bony orbit to expose the conjunctival sac. I will press directly against the eyeball right now. So with my other dominant hand, I'm going to hold the medication, and then I'll ask the patient to open their eyes and look up to the ceiling. This way, I'm trying to ensure that the eyedropper will be able to directly go into the conjunctival sac for the medication. Once I do that, I'm going to gently go over the eye and put the medication above the eye, about 1 to 2 centimeters or half to 3/4 inches above the eye, and then use the eyedropper to drop 1, because the order says 1 GGT, which is 1 drop in the eye. Once that is done, I'm going to go ahead, switch, do the same process. My non-dominant hand on the cheekbone, press down gently, 1 to 2 centimeters above, 1 drop into the eye, and do the second one. If for any reason during the administration the patient blink or it missed the eye, I will have to redo the whole administration, and I'll clean the face and then reapply the medication. 1 drop, the other says 1 drop. And then once that is done, I'm going to take the washcloth and drop. At this point, the medication is done. I'm going to close the cap, put it on the side. I'm going to take another washcloth and put it on the nasolacrimal duct of the eye gently. That's like the tear duct, and put the towel there. No pressure, I'm just putting it gently on the eye, and then I'm going to do that for about 1-2 minutes so that the eye pressure and whatever excess fluid can be taken out. Once that is done, I'm going to apply that same process to the second eye. Once I've been able to achieve that, I'm going to take that washcloth, without applying pressure to the eye, I'm going to take that washcloth, put it in the trash, and then I'm going to remove my gloves. At this point, I'm going to place the patient back in a comfortable position. I'm going to ask them if they have any side effects, if they're feeling any burning or stinging sensation. I'll let them know to call. Like I said, I'm going to place them in a comfortable position, put the call bell close to them, and then raise the bed eye, put the rail over for their safety. And then I'm going to gather all my supply, leave the room, provide privacy for the patient. Mr. Smith, if you have any concern or anything, please let me know. Use the call bell, and I'll be back in 30 minutes to see how you're doing. Once the patient is okay with that, I'm going to leave the room, provide privacy by shutting the door, and then document. Thank you.